Good evening, everybody, and welcome to the Heartfulness Wellness webinar. Today, we are going to speak about COVID-19. Is there a way out? Today, India completes 3 weeks of quarantine or lockdown, and some states are starting with 2 weeks of quarantine after this again. Now, to discuss on this, we have two panelists with us, Dr. Ravindran and Dr. Mahesh Reddy. Dr. Ravindran, he is a consultant, interventional and general radiologist. He started his work in India and then to UK and is now working in Canada. He is an interventional radiologist in Department of Abbott Regional Hospital and Cancer Center for the last 11 years. He has also published quite a presentations in UK and Canada. He is a zonal coordinator and oversees the heartfulness meditation activities in Western Canada. So welcome, Aravindhan. And the next panelist that we have is Dr. Mahesh Reddy. He is a clinical microbiologist. He has completed his graduation and post-graduation from AFMC Pune. He has fellowship in clinical microbiology and infectious disease from Northwick Park Hospital, London, UK. Currently, he is working as an officer in charge of viral research and diagnostic lab, Command Hospital, Lucknow. His fields of interest are in molecular biology and its application and diagnosis of human infection diseases. He is a trainer in heartfulness meditation. He is actively involved in conducting lectures and training workshops on physical and mental wellness. So welcome, Dr. Mahesh Reddy. So today we are going to start our topic. Okay, so today the basic thing we start with is what is the current scenario of COVID, the corona infection, and where do we stand? How scary is it? To start with, let's start with Dr. Mahesh Reddy. Mahesh.
Yeah. I think this virus is clearly here to stay unless we eradicate it. And the only way to eradicate such a virus would be with an effective vaccine, which is not there presently. Officials worldwide are scrambling to reduce the rate at which the new infections are arising, and basically to avoid overwhelming burden on an already strained healthcare system. The healthcare workers are facing long hours of work, exhaustion, burnout, and very importantly, increased risk of exposure. We are able to control the number of new infections by this lockdown in India, but we cannot really stop it in future because at some or other point, we have to come out of our houses, go to work, and children have to go to schools, isn't it? So if the spread of infection goes on for a longer time, we are looking at loss of jobs, closure of small businesses, and economic fallout. So it's going to stay for a long time.
And Arvind, what is your take on this? How scary is the situation today?
Well, it is quite serious, as we know, and most people would have looked at the news. It's a pandemic, meaning that it's although it started from one place, it's now spread across the globe, and the rapidity with which this has spread is one of the serious aspects. And in some ways, but where in some countries where it's affected quite seriously. For example, in the U.S., neighboring country for us, the incidence in New York is about half of what has happened across the U.S. So a lot of people are in the hospitals, and a lot of people are dying. So a lot of the hospitals are facing the capacity issues and problems dealing with it. In fact, in some of the places, the healthcare workers are also affected and have been dying because of this as well. When it comes to whether it's scary, yes and no. Yes, it is scary because it's very serious and it has to be seriously taken. There's no doubt about that. Because a lot of people who may be carrying the infection are not symptomatic, and they may be spreading the infection. So that's one of the serious aspects of this, and that's why the places where they were able to proactively do the social isolation and physical distancing, they seem to be doing better in achieving a bit of control or flattening of this curve compared to others where they reacted or acted a little slower than before, slower than the others. And the positive side of it, though, is the fact that a lot of people who get infected are not going to be serious. Some 8 out of 10 people or going to be either asymptomatic or not going to be having serious illness. So that's the other side, so which needs to be borne in mind as well. But certainly, that shouldn't relax us from saying that this is, I'm going to be fine. I think we are, in some places at least, the stringent measures or the strict measures put into place have been, still helpful. But still, we don't know how far the extent of this illness is, because no country has the capacity to test everybody at this point of time.
So looking into that, there is a lot of anxiety in people. And so what would you like to tell them how to cope with the future? What is going to happen in the future? Arvind?
Well, our immediate future is going to be, the priority is how to flatten this curve and how to prevent or stop this community transmission, person to person infection, which can happen if we are in close quarters with each other. That would be the immediate priority. And in the longer term, like what Mahesh had said, we need to have a vaccine, and people are actually working on that. So, and we don't know how long it's going to be. It could be 6 months, it could be 1 year. And even if we have a vaccine, it has to be mass produced in such a way that we don't, it has to reach everybody. Until that time, our immediate future is going to be stop the spread from happening, which is what is the immediate priority. And consequently, because of uncertainty over this, or being in social isolation or lockdown and being without a job, it has its own consequences, not being anxiety, for example, or other kind, or, so many other emotional disturbances that can happen with this. I would say, I have a simple mantra for this. Do not lose sleep. It's an acronym for sleep. Is while you have the ability, use this as an opportunity. Sleep adequately, learn a new skill or learn something, a music, meditation, yoga, or something like that. Eat healthy, exercise adequately. You can do yoga and pranayama without having to mingle in a group or without having to go outside somewhere. And take forward your priorities in life and be positive. And remember, this too shall pass, PASS, personal hygiene. Accept the situation and adapt to the new change. There are so many new changes that are going to happen, and we have to go and adapt with this change, like online education or working from home using links. And then be safe for yourself and others. And sanitation, make sure all the surfaces we touch and the way we interact are going to be changing.
So Mahesh, what would you like to tell people who are anxious with anxiety? What holds for them in future?
I would say it is very natural to feel stressed out, anxiety, and feeling anxious and fear during these times because of media bombardment. It's very natural. This anxiety or stress comes from uncertainty of the future. It manifests physically as restlessness, palpitations, or mentally like excessive worry and inability to focus. So how to cope up with this? I agree with Arvind that sleep is very important. Food, like change in food habits to fresh fruits, fresh vegetables, exercise and meditation. I feel do positive things. Try to be in the present moment. Take simple tasks one at a time, finish it. It gives us confidence. Engage in household chores, play indoor games with children, read books, talk to family members. So these are the simple tasks which will boost your confidence and then remove the anxiousness. Avoid too much of news and social media. Avoid substance abuse, especially alcohol. It's not the way out. Okay. So these are the measures I would suggest to prevent anxiety and stress.
So is this the new normal that what everybody is thinking about? Change in what we were thinking earlier. So is this
Yeah.
the new normal?
Yes, this will be the new normal, and we will be having a new future ahead.
Okay. Okay. So looking at what both of you are saying is that we are coming down to the old principle of prevention is better than cure, right?
Yes.
Mahesh?
Yes, that's correct.
Arvind, anything from your this thing on this?
Yes, absolutely. when we say prevention, and prevention does not necessarily mean vaccine alone, and prevention meaning what I can do from my point of view, maintaining personal hygiene. One thing to remember is like this is like a flu illness, except that the virulence or the potency of this is much more. So whatever we would do, in terms of preventing myself from getting it, and also if I have some common symptoms of cold, whatever I would do to prevent others from having it is also important. So that's also part of prevention, like covering my mouth and nose when sneezing, not with my hands but with my elbows, and making sure I try not to infect others by wearing a mask if I'm feeling unwell, and wiping the surfaces which we touch constantly, or not touching our face constantly. Those are some of the aspects of prevention as well, as part of personal hygiene. So that should be in place, and like we mentioned, that would be the new normal going forward. Some of these things we would do that normally during flu season, but what I have noticed is not everybody takes that seriously, and maybe it's something which we need to focus on nowadays.
I'd like to put stress on preventive aspect. Why it is important is, honestly, the idea is good, and most of the governments are pushing, including our Indian government. The problem is with our masses. I feel they are not yet mature enough to understand the science behind prevention is better than cure. We, as a specialists in the medical field and having expertise, we have to help out our neighbors, our fellow people in the society in which we are living in. One of the most important reason not get infected in India is financial. Majority of Indians do not have health insurance. God forbid a person gets a severe infection, the significant financial burden over the family, you can imagine how much it will be. So I feel prevention is the most important aspect in this pandemic. Over to you, Manish.
Okay, but for prevention, there are a lot of many people who are anxious about the prevention part. So, is there some other tests or something that people want to know? Is that we can do it beforehand to see that I don't get this infection?
Basically, we have two kinds of tests currently available. The first is the PCR, or real-time reverse transcriptase PCR test, which detects the viral nucleic acids, that is the RNA. The second one, this RNA test is done on basically the nasal secretions and the throat swab. The other test is the blood test, in which we detect the antibodies which are produced against the virus. Initially, after infection, the person to develop the symptoms and signs, it takes some time, which we call as window period or the incubation period, which is about 5 to 7 days or 14 days, or in some cases it's 3 weeks. Person developing symptoms means the virus is replicating very actively inside the body. That means these nucleic acids are detectable. The virus is detectable in the blood. And this can be till 7 to 8 days or 10 days. Till that time, virus can be detected. Later, after developing symptoms, 7 to 8 days after that, we start producing the antibodies against the virus. So in that initial 7 days period, antibody tests are ineffective. That cannot be used. Though they are very rapid, produce results in 15 minutes, they can't be used for diagnosing infection. They can only say after 7 to 10 days of symptoms whether the person is infected with coronavirus or not. As of today, these tests help in identifying people in uh, quarantine or lockdown, large number of cases happening in a single place. So these patients can be tested for positivity, and the rapid results are there. Then we confirm it by molecular testing. As of now, please, this is for everybody, please do not insist on testing. Let the doctors decide whether you need a screening test or not. This is very important. If you start asking for tests, it will be unnecessary burden on the healthcare system, especially the labs of the hospital.
So Arvind, you are an interventional radiologist. Do you advise any radiological test which we can do? Because we have been hearing that this coronavirus affects the chest more. So is there something that we will advise people would like to do it, or it is the same thing as Mahesh what she is saying?
Correct. Yeah. So this is not, both the chest X-ray or CT, or for complications that could happen, when it affects the chest. So again, it should be guided by what the doctors, particularly the intensivists or the emergency people and the physicians feel about ordering these tests. It's not a first line test. It's not a screening tool like the blood test, what Mahesh was talking about. It's only in situations where it's important to rule out any complications of the COVID. Bearing in mind, most people have only minor symptoms, so we don't need to use such big measures to try and diagnose it. In many instances, anyway, the chest X-ray or CT can only indicate the changes, but it doesn't tell you whether for sure this is what COVID is due to, whether this is due to COVID.
Arvind, I heard recently in the news that Indian software company is producing artificial intelligence algorithm based on the X-ray findings or the changes in the X-rays and give the results in 20 seconds, saying whether it is coronavirus infection or not. It's showing 96% conformity. That's what they're claiming, but they've put up for FDA approval. I think after FDA approval, we have to see the results.
Correct. Yeah. So again, the chest X-ray or CT findings are extremely sensitive, but they're not quite specific, and they can't tell whether it's due to, it could be some other influenza virus, and there are other non-specific organisms can cause this as well.
Similar
It
kind of.
can be correct, and it can be helpful for sure when there is a mass incidence, like when the capacity is overloaded for the PCR testing, and when they have no means. I mean, they have used that in China, where they had to use CT scan and chest X-ray because they ran out of capacity to do the blood tests. Under those circumstances, it's different. But to roll it out as a primary means would be, because every time we do in a suspected patient, or we'll have to assume everybody's infected. We have to clean the room and surfaces. It takes a lot of time to turn around for that, instead of having to have a swab or a test.
Okay. And what is the situation? Where are we in getting a vaccine for this?
As of now, Manish, the vaccine trials are going on in the world. Around 70 trials are going on. And out of these, only 3 are the human trials which are at present going on. And I think it will take a year or a year and a half for an effective vaccine to come, and then and mass production to happen. There are other modalities now, like plasma therapy. Recently, yesterday, 3 Indians were treated in US with a convalescent plasma which contains antibodies against this virus. They used this plasma to treat these 3 Indians who had severe symptoms because of coronavirus, and it showed some positive effect. But still, it has to be done in a large scale, and findings have to yet to come.
And what is your take, Arvind, on hydroxychloroquine or medications which people think can be taken to prevent getting these things?
Yeah, I know in a lot of centers across the world, they're using hydroxychloroquine, which is an anti-malarial drug for treatment once the patient has contracted. And they do have an algorithm to go through as to when they would start a chloroquine. But again, there's 1 or 2 papers on that, and experience only from a few centers on this. And we are going to be finding out more about this. But certainly not as a prevention. The anti-malarial drug also carries side effects, and I wouldn't. And there's no recommendation by any organization, including the World Health Organization, about using chloroquine as a prevention. but certainly a lot of institutions are using hydroxychloroquine as part of an algorithm based on the severity of the infection, and not in asymptomatic people, and not in people as a preventive method.
I feel this has been wrongly popularized, hydroxychloroquine, and in Indian pharmacies, you can just go buy in any pharmacy, and they are completely off the shelf now. And we should not take this chloroquine without doctor's advice. What I feel is, and the government has advised only two categories who should take this medicine. Firstly, the healthcare workers who are actively seeing these cases, and secondly, the household contacts who have a lab confirmed COVID case in their home. Only those two categories have been advised chloroquine therapy in India. Rest all should not just pop up these pills. They have lots of side effects on heart, and in combination with other drugs, can be fatal at times.
Okay, we keep on hearing that this is the first wave of COVID-19 which is there. We may have something second again coming up, a third coming up. What is the exact situation? Mahesh, can you elaborate something on that?
Yes, Manish. As you know, the coronaviruses, there's been a dip during summer months. In the last, if you see SARS coronavirus outbreak in 2002 and MERS coronavirus 2012, slight dip during the summer months. But this time, we have seen that this coronavirus spreads even in hot and humid climates also. But definitely there will be a rise in winter months, especially November, December onwards. And we should be prepared for that. Like any influenza or any respiratory viruses, they have a propensity to have large number of infections during winter months. And we should be prepared for this second wave, third wave. So in the second wave, we should be looking at impact in our resources on non-COVID conditions, because we are prepared now for COVID, but we are neglecting the non-COVID emergencies or conditions now. And during third wave, impact on chronic conditions, especially chronic kidney patients, chronic liver patients. And as you go along, as the time prolongs, there will be effects like the mental illnesses, the economic injury, burnout and exhaustion in doctors. We'll be seeing all these as the outbreak prolongs. That's what I feel.
And what do you feel about this, Arvind?
Yeah, Mahesh touched upon several important points. We are going through one, and as we get back to normalcy, we may see the second wave. And bearing in mind, there are still people out there who may be not having symptoms, but still may be carrying the infection. So and again, I have no doubt this is going to happen. And there are a lot of efforts to try and do mass testing and testing on a rapid basis, and also rollout. So we have to be testing a lot of people and almost everyone. So when that capacity comes, there is hope, at least, in preventing further waves and trying to stem that further waves. So as we begin to become normal, we still have to keep our efforts persistent on the aspects of personal hygiene, and that will go a long way. We'll have to still, until a vaccine has been developed, and until we have ability to do rapid testing, we still have to assume that we may be carrying it and act in such a way that we don't try to infect others. So, and like what Mahesh said, once we lift the isolation and go back to certain amount of normalcy, there are other things which need to be taken care of other than COVID. So whatever we can do in our capacity, we still have to continue to do those until we have a longer term solution. We don't know how this virus is going to behave. It could be like the previous SARS infection, previous coronavirus infection, where it's kind of doesn't have a lot of instances anymore. Or it could be kind of little sporadic, in the sense like it can come up occasionally, like the Middle East respiratory syndrome. So those are all types of coronaviruses. So we don't know at this point of time. how it's going to behave. So it's important we carry on with the persistent efforts. One of the important things which we have learned. Interestingly, I was looking at the Spanish flu, which happened in about 100 years ago, and they had apparently about 500 million people were infected by this, and it's one of the deadliest disease in the human history. Well, they say it's the deadliest disease in the human history because it killed about 20 to 50 million people. And one of the factors at that time they talk about was why it was very hard to contain it is public indifference and not being able to isolate, because people thought it was a common cold, and they felt, oh, well, it's common cold, and it's not. We should learn lessons from those. How take isolation seriously and take personal hygiene seriously, and there should be a lot of public education involved in this as well.
So along with that, there is a lot of fear that this is transmitted through animals, through pets, mosquitoes. What is the actual situation, Arvind? Any take on this?
Yeah, so we know for sure this is with the previous coronavirus infection that this has been transmitted from an animal, or the most likely the reservoir has been the bat, meaning that the source of infection from which the humans got infected is from a bat, which again Mahesh can talk about it a little more about this. Right now, the transmission or spread is happening from human to human, and there has been reports about in a zoo where a tiger got infected, which is unfortunate. But mostly, this has been through person to person, not from certainly in countries where there's a lot of mosquito issues. This is not going to be transmitted by a mosquito. This is still a human to human transmission. And I think Mahesh can talk a little more in detail about this.
Yeah, Arvind. As of now, we got the infection from wild animals. That's what the science is saying. But from which ones, bats or the pangolins or the anteaters of China, we don't know yet. They still have to do some research on that. But definitely, if you see the previous infections, like in SARS coronavirus outbreak of 2002, it was from civet cats, and MERS coronavirus was transmitted by the camels. So definitely, it has been jumping from wild and or the animals to human beings, and later human to human transmission. As of now, the large number of cases are because of human to human transmission. And to protect ourselves from these, basically the Chinese and all which go to live animal market, they should avoid direct contact with those animals, and also prevent themselves from touching the surfaces in which animals are kept, and food safety practice at all times. Even in India, when we get raw meat, and we should cook it properly before consumption, because undercooked or poorly cooked can also transmit the virus if you're handling the meat and meat products. So that's why. What about this one? As far as insects, I don't think insects can transmit. Pet animals, uh, maybe cats or feline species can get this infection, but the transmission from them to humans is still not yet confirmed. Maybe the people who are very close to them, like the zookeepers or handling pet animals, might get, but still it is under research, this one.
And what about Mahesh? There are fear of people that patients who have got all right from COVID, or healthcare workers who are working for patients down with this infection. How much do they spread it?
There's lots of stigma, like we have seen for HIV or leprosy or tuberculosis. We've seen instances where they're afraid of these patients who got treated and they're coming home, and also the doctors who are actively involved in treating of these coronavirus infections. It's been seen that once you're cured of it, like we declare in the lab that patient is cured when two 2 nasopharyngeal or oropharyngeal swabs. When they turn out negative only, and patient asymptomatic without any symptoms, we declare him as cured, and then we send him home. That means his virological clearance is there from the secretions. But sometimes it's been observed that even after asymptomatic, they may carry viruses inside their body for around 3 to 5 days. So they should be in isolation during that time post treatment. And in some cases, they've seen reinfection, or that means the patient has been cured, but getting again signs and symptoms and testing positive for coronavirus. Now, is it reinfection or is the virus dormant in the lymphocytes inside the body? We've yet to find out. Research will only confirm these findings.
Arvind, you want to add something?
Yes, there are, like in these times, the healthcare workers are at the forefront, and some specialties more than the others, and they are taking the impact of this. And first things is like like for healthcare workers, and again, there are a lot of instructions for the healthcare workers and how to take care of themselves first, and not put themselves into harm's way. Protection, and so many other things. And again, at the same time, we also know in countries where, despite all these measures, they have run short of these protective equipment, and still the healthcare workers have continued to deliver the care because it's in their DNA or ingrained to do that, and get affected as well. So protecting the healthcare workers is one of the priorities, and that's why in many places, the healthcare workers, when they start having symptoms, it's advised not to go to work, and then get tested, and a lot of places it is prioritized, and that's why, as Mahesh said earlier on, it's best not everybody to insist on testing. It's important to leave those resources intact for needy people, people who are elderly, who have other problems, who are at an increased risk, and the healthcare workers, because we need to preserve the amount of healthcare workers we have. Certainly, the healthcare workers are doing their best to protect themselves and also treat others. So, message to healthcare workers is always, stay safe, keep yourself protected at all the times, and then comes the other aspects. And the other unfortunate thing, which Mahesh again alluded to, is stigmatization. There shouldn't be any stigmatization on this. There are a lot of there's science behind the social isolation. There's science behind distancing and how to protect ourselves. As long as we follow those, there's no need to stigmatize anybody, and don't have any fear about contracting the infection just like that. Again, one of the I would say, for a lot of some of the specialties, for example, intensive care people or emergency physicians, I've heard stories, and I know some of my colleagues do this as well, like where they have, after coming back from work, they are isolating themselves so that they don't send the infection, spread the infection to their own family members. So it is a very stressful situation for those people as well. So we should understand these things too.
And what would you advise to people who are not healthcare workers? What precautions they can do at home, or what simple things they can do at home, or for the people who need to go to work, what are the simple things that they can do to prevent these things? Arvind?
Yeah, so WHO and several other health authorities have come up with really good guidelines on this, about personal hygiene, meaning that wash our hands at least for 20 seconds and dry them up thoroughly. We don't need any special alcohol hand sanitizers, because we see that in some places we have run out of hand sanitizers, and people are just grabbing that off the shelves. Just normal soap will be good enough, and but wash it thoroughly, and then dry them properly. Cover covering the face while sneezing. If you do have cold or cough, try not to go out, and try to keep yourself at home. And the things which we touch commonly, we need to wipe them off, wipe the surfaces, make sure they're all clean. So those are some of the aspects of personal hygiene. The other aspect is, if we do go to work, and the universal mask usage is beginning to be coming to acceptance nowadays. So they again use the mask, particularly if you have some cough or sneezing, then use the mask, because it's mostly the mask is to prevent the infection from us going to others. And it's also a reassurance for others that we are doing our bit to protect others. So these are some of the aspects, like for people who are at a personal level, and for people who are involved with patient care, and people who are involved, nurses and or physiotherapists and other healthcare workers other than physicians, try to keep a separate set of clothes and wash them when you come back from work, and leave those in a separate place, and go back and have a shower before you interact with family members, things like that.
Mahesh, would you like to add something in what he was saying?
Yeah, like at home, simple measures like when we go out and bring vegetables, milk, and etc., you can wash them thoroughly. When we come not to interact with family members, we first use hand hygiene measures, and then only you can interact. And basically, respiratory hygiene, if a person is having flu-like symptoms at home, and if it is a confirmed case, it's better to, no need to panic, better to isolate the person in a separate room with an attached toilet. And only one person should be attending to him rather than everybody. And disinfecting the surfaces of that room using simple homemade solution like bleach. 7 grams of bleaching powder in a liter of water is good enough to do surface disinfection. That simple measures can be used. And work, when we go to work, we have to, as Arvind elaborated, basically hand hygiene and respiratory hygiene, physical distancing. And the most important part is we invariably be touching lots of surfaces at work. Do not take your hands to your eyes, nose, and mouth. This was suggested by eminent virologist Dr. Ian Lipkin. Not to bring your hands to your face. Basically, the portal of entry of virus is through eyes, nose, and mouth. So if you can avoid bringing your hands to your face unconsciously or consciously, that's the important method of preventing this infection.
So what I can understand, like we have table manners, we'll have to follow a few of the mask manners also now, right?
Yeah.
So what is the thing? Do everybody require a mask now regularly? Like we buy a set of shirts, we need to have a same mask also?
At home, if nobody is infected, no need of mask. If somebody is having flu-like symptoms, he needs to wear a mask. Basically, there are different kinds of masks available in the market. Basically, in the hospitals, we use surgical masks and N95 masks. And for common people, there are homemade masks or home face covers, they call it. Coming to this, to elaborate on this, N95 mask is exclusively for healthcare workers, and it is not for common people. This has to be emphasized to each and everybody, not to buy N95 masks and create basically for healthcare workers deficiency of these essential items who are at very high risk. Surgical masks can be purchased by common people. They are good enough, and they are disposable. Very important thing of surgical masks is their one-time use. You have to use it for 4 to 6 hours, and then you should dispose it off. It can't be reused. Whereas the homemade masks or face covers, we can reuse it. Like after carefully removing it, pulling the strings or the elastic part, and then You can sterilize it by putting in like that solution I described, simple bleaching powder in a liter of water. You can put that mask for 15 minutes. It gets sterilized, simple. And then you put it in with other linen in washing machine, wash it and dry it in sunlight. It's good enough for using it again. So for common people, they should have 2 to 3 masks per person. So when they go out, they should use it. And when they come home, they remove it and then use the sterilization technique. So that's for common people. But they should not use N95 mask and spare it for the healthcare workers who are in dire need of these masks.
Arvind, you want to elaborate something more on the mask manners?
Yeah, I like the term mask manners, because that would that could be the new norm for maybe for some time for us. The important thing to remember is, we should not have a false sense of security just because we are wearing a mask, and take the common precautions again. Like trying to, if we have a mask, and even amongst the medical community, this can become a tendency where we have touched something and the contamination of the mask then defeats the purpose of wearing a mask. So making sure we curtail those habits as well. Once we, one of the important things, and it's very hard, once we established a habit or a pattern, it's hard to control those. But again, we have to adapt to this new normal and try to curtail the habit of, even if we have a mask, make sure we don't touch it often and make sure it's all clean properly. And again, bearing in mind, the important thing to bearing in mind, most of this is not going to prevent you from getting an infection. It's only for you to prevent others from having this, because we don't know who's carrying and who is not. That's why it's good to wear those, but also take care of, be aware of other aspects, like wherever possible, physical distancing and keeping the surfaces clean and keeping your hands clean.
So one last thing, what I can understand about our discussion is, when can we get back to our routine again? Everybody is apprehensive about it. What is your take, both of you?
Not in near future, I feel. It will take months to get back to normalcy. It will take time. That's what I feel.
Time. Yeah. Arvind, your take? When is this going to get normal?
So it's a very good question, and it's a question which is there in everybody's minds. When are we going to get back to normal, and how is the new normal going to look? Is this going to be a changed world? Is this going to be something very different to what we're used to? And that's one of the uncertainties we are facing. At this point of time, instead of worrying about that, I think we should focus on what we are having at this point of time. Try to flatten the curve, meaning that try and stop this community transmission, try and stop what is happening, and also use this opportunity. That's really vital. That there is a pass given to a lot of people who have been running and who've been working, or not being able to spend time with family. So it's a nature's way of giving us that pass. And why don't we use it productively? Try and connect with people, connect with the loved ones, and be in gratitude, be happy for what we have. There are instances where gratitude has been shown even in the medical publications, that it's very important process for healing, and it's a very important attitude to have, to feel happiness and also overcome situation in times of trouble. Accept and have gratitude for whatever has been happening around us and what we have had. I'm not saying we have to stop taking measures to prevent this. It's just trying to accept the situation and see, and it does give us a clarity to act in the future. The new normal, going forward, there's going to be a lot of mental illnesses amongst the healthcare workers, as well as in the public. So we should use this to prepare for that. And even the prevention aspect, what we are talking about, should encompass that as well. And that's where, we are advocating people to take up activities like meditation. It's a simple thing, simple home-based technique which we use. And we're asking, well, I've been conducting meditation sessions for my health region employees, because we know the new normal or a second wave or the third wave, whether it's with the disease or not, but there's going to be some kind of wave where people are going to be affected mentally. So we are preparing them to take up this meditation as an aspect to enable them to cope with those. So use this opportunity to learn those and be prepared for those things, because a new normal we don't know. And while we do this, it also gives us the ability to adapt to change. We don't like to adapt to change, but doing these things, connecting within ourselves and staying in touch with the loved ones will help us to adapt to any new change that can happen in the future.
Wonderful. Thank you. I think so that answers quite a lot of our questions. Thank you, Dr. Mahesh. Thank you, Dr. Arvind. It was wonderful talking to both of you. Stay safe, be active as usual, and let's be prepared for the future, what holds for us. Thank you, everybody.
Thank you.
Thanks, everybody, for joining today. Okay, we have few more things attached. We have a next webinar which is coming up also. And to know more about Heartfulness Wellness initiatives, or if you have any personal queries of your well-being, please do write to us on wellness@heartfulness.org. You can even locate your nearby meditation centers or heartfulness trainers at www.heartspots.heartfulness.org. We have around 6,000 heartspots in more than 130 countries. You can even log on to www.heartfulness.org to know more details about us. You can also be connected with us through Hearts app, the Heartfulness on YouTube channel. You can subscribe to us on the YouTube channel also. And you can always join us for the 3 masterclass sessions by our spiritual guru Daji or Kamlesh Patel. It's available on www.heartfulness.org/English masterclasses. Do join us. And these are the other things where you can connect to us, understand more about COVID, understand more about wellness, and understand more about heartfulness also. The next webinar is going to be tomorrow, 16th April. You have the Mythbuster, Pregnancy and Infancy During Quarantine. We have eminent speakers like Dr. Neeta Singh, Dr. Pawan Kumar, and Dr. Tejal Porolkar. Thank you for joining us today. Let's meet tomorrow again. Thank you, everybody.